Welcome to Garden of Fertility. I am Opera Stella Thelma, your fertility counselor. Today we are going to be talking about the reasons why some pregnant women give birth to disabled babies. But before I proceed, I would like you to subscribe to my channel. Turn on your notification button so that you'll be notified anytime I upload a new video. The birth of a child is a joyous and a life-changing event. However, some pregnancy results in the birth of babies with disabilities. It is essential to understand that there are some factors that can cause the disability in a newborn child. In this section, we are going to explore more reasons why some pregnant women give birth to disabled children, throwing more light on the complexity that is involved. Number one is genetic factors. Genetic factor plays a significant role in the development of disabilities in a baby. Some disabilities are inherited, meaning that they are passed down from the parents to their children, such as Down syndrome, sickle cell anemia, cystic fibrosis, can be present in the genetic makeup of one or both parents. In these cases, there is a higher chances to give birth to a disabled child. Genetic counseling and parental genetic testing can help to identify the potential genetic risk and provide expectant parents with information or support. In this genetic factor, it can be as a result of inheritance. Maybe the parents have a Down syndrome. It can also be transferred to the newborn. Or maybe someone in the lineage before have such disability. So far it is in their genetic line. The tendency that somebody or a child may inherit it from the same lineage is there. Number two, maternal health condition. The health of the mother during pregnancy can impact the development of the fetus. Some maternal health conditions increase the risk of disabilities in a newborn. For example, controlled diabetes during pregnancy, that is, gestational diabetes or pre-existing diabetes, can affect the development of the baby and lead to birth defects. Additional maternal infection such as rubella, that is, German measles, or cytomegalovirus, all these things can cause disability in a newborn if it was contracted during pregnancy. It is crucial for an expectant mother to receive a proper prenatal care, manage any existing health conditions, and follow medical advice to reduce potential risk. Number three, exposures to teratogens. Teratogens are substances that can cause birth defects or disabilities when a fetus are exposed to them during pregnancy. These substances can include certain medications, illegal drugs, smoking, tobacco, alcohol, and environmental toxins. For example, alcohol consumption during pregnancy can lead to fetal alcohol spectrum disorder, which can cause intellectual disabilities, physical abnormalities, and behavioral issues in children. Avoiding exposures to teratogen during pregnancy is very crucial in order to reduce the risk of disabilities in a newborn. Number four, infection during pregnancy. Infection contracted during pregnancy can cause a very serious risk in the unborn child. Some infections such as Zika virus, rubella, or toxoplasmosis can cross the placenta and affect the baby's growth and development, potentially leading to disability. Taking preventive measures such as practicing good hygiene, getting vaccinated when appropriate, avoiding exposure to a known infectious agent can help to reduce the risk of infection during pregnancy. Number 5, complications during pregnancy or birth. Complications during pregnancy can contribute to the occurrence of disability in a newborn child. For example, premature birth, that is birth before 37 weeks of gestation, can increase the risk of development, cognitive impairment, and physical abnormalities. Complications during childbirth, such as oxygen deprivation, traumatic injury, or umbilical cord problems, can also lead to disabilities. Adequate prenatal care, skilled medical assistance during labor and delivery, and prompt management of any complications are crucial to minimize this risk. So, the reason why women give birth to disabled children are multifaceted and can involve genetic factor, maternal health condition, infection during pregnancy, and complication during labor or delivery. So, it is important to know that not all disabilities can be prevented, as some arises from complex interaction of genetics and environmental factors. However, seeking appropriate prenatal care, managing health conditions, and exposing to harmful substances, avoid exposures to harmful substances, and taking preventive measures can help to reduce the risk of disabilities and promote healthier pregnancies. Genetic counseling, prenatal testing, and open communication with your healthcare provider are valuable resources for an expectant parent and navigate potential risks. So, all these things being mentioned above can cause a disability in a child. So, we should take note of that. Prenatal care is very, very important, and the testing. So, you need to work in hand with your healthcare provider, your fertility counselor, a gynecologist. You are also being advised to monitor what you eat. It's very, very important. Your intake determines your output. So, you manage your diet so that it cannot affect the unborn child. And I know you find this section informative. Please don't forget to share, like, and comment on this video. Drop your questions. I personally will reply you, because somebody outside there may be waiting to get this information to get rid of his present challenges. Thank you for watching. See you in the next section.